I can stay at home with full salary because I am thalassemia major. I don't want this to happen because I can work more. Handicap is handicap. Thalassemia, your transfusion is on time. You have your chelation. You are in good health. You are not handicapped.
Lactose and potential.
So we try to kind of
all these tests.
I retired, and obviously, but thankfully.
All right, Gulf News is back with a brand new episode of Tell Me Why. And today's episode is actually a follow-up on a previous episode that we had on the topic of thalassemia. And joining us at the time was Dr. Mariam, who spoke about it from a medical point of view. Now today we're joined by Saeed Al-Awadi, who is a thalassemia advocate. And he's here today to share his journey with the disease and to spread awareness as well, to help with spreading awareness. How are you, Saeed?
Fine, thank you. How are you?
It's lovely to have you in the studio.
Thank you very much.
So please introduce yourself and tell us how your journey with thalassemia started.
Myself, yes, I'm Saeed Al-Awadi. I was born 47 years ago in this country with disease of beta thalassemia major. Definitely history of thalassemia. You had good brief from Dr. Mariam. She's very famous in the field. We know her very well. She knows us very well as well. 47 years old patient of thalassemia. If you ask what do you remember, definitely he won't remember in himself the disease. 47 years ago, you can only imagine how was the healthcare service in a very young country at that time. So I was not diagnosed as a thalassemia in the country. What I'm hearing from my parents, that he has bilirubin.
Okay.
I was not having passion to eat, not drinking milk, not sleeping well, crying. So my color became yellowish. So they don't know the reason. At that time, luckily, my father was able to take me for treatment abroad or seek any other advices. So they took me, I believe, first time was in London.
Okay.
My first visit was in London. It was around 4 or 5 months old. It was very little. So in London, they said, yeah, there is a disease called thalassemia. Your son is having that disease.
Okay.
They were knowing about thalassemia, definitely. For us was very new, and especially in our family. Right. I'm not saying I am the elder patient of thalassemia. No, there are elder than me. But maybe they had that knowledge. We didn't have at that time. We were very few patients at that time. Then from London again to India for second opinion. Also, it is a thalassemia. He needs to receive blood transfusion monthly till end. When is the end? No one knows, but it's shorter than normal human being. This was there, and later on we will talk about even this point.
Yeah.
So my first blood transfusion was, again, not in India. For third opinion was in Germany. First blood transfusion was in age of 9 months old.
Wow.
So
Okay.
they had to transfuse me, otherwise I will be not here sitting now. From that day, my journey with thalassemia started with my parents. I don't remember.
Right.
I don't remember at that age. But I became to know about thalassemia more after I got twins brothers.
Okay.
So with the twins brothers also they were diagnosed as a thalassemia. So everyone at that time, and this was early days, 1983.
Right.
Both of them with the same disease. So my parents are aware what's going on, and they know this is the same journey of Saeed. We have to continue the same with the other two twins.
Right.
There wasn't a test, prenatal diagnosis, these kind of things. So it was by luck. Both of them with beta thalassemia, and I was seeing them in very young ages, how the cannula was difficult. So this happened even with me.
Yes.
But I didn't have that feeling at that time, or understanding, or memory, good memory. So all my journey with thalassemia is with these two brothers. The major part was I was 5-6 years old. I was just hearing others saying, those two are the same. like Saeed. Because I didn't know I am having any special need. I am sick, I am going to hospital, transfusing blood, and coming back home. So those are same as Saeed. So it's like you see someone on wheelchair and other two on wheelchair. Those two are the same as this one.
Yeah.
Then became entering to school days, and school is at the beginning in the school is almost play, joy, football, jumping. These kind of things we were not allowed to do.
Oh, really?
Yeah, do not do it. These people have. Saeed has thalassemia. He might bleed at any time.
Okay.
This was strange for me as a child in front of my friends, but we have to live with it. When God gives us problem and solution, we have to follow the solution.
Absolutely.
For hospitals, I remember, thalassemia is a journey of blood transfusion and iron chelation. Blood transfusion is very safe nowadays. The blood is tested very well. It is, you can say, 99.999% is safe. But the iron chelation, that's the thing kills thalassemia patient in early ages. The iron overload in the body.
Okay.
So we have to control the iron level. Iron level control was different than today. It was till, I believe, till 90th or more. No, till 2000, 2001. Iron chelation was a needle. I have to put it in my stomach for 12 hours.
Wow.
Yeah, with carrying pump of syringe. So this syringe will continue giving me this medicine for 12 hours. So tomorrow after 12 hours, when I remove this for going to school, am I able to go to school? Or there is infection, I cannot wear my clothes. Lot of these kind of things. Mental wise was making our life little bit harder than others.
Yeah.
And for parents as well, because no nurse will come home to put this pump. My mother was teach to how to prick us, so I believe it was painful for her more than I.
Absolutely.
Yeah.
Yes.
And we were crying, I don't want this. I was seeing this in my brothers, so I can imagine even myself I was the same.
Yes.
Maybe for mine was painful more for my parents, because I was the new case of thalassemia in this family.
Right.
Those two, they were having little bit experience. Yes, there are difficulties. In all, you cannot say when you are child your difficulty is less. You become young age is a little bit more, or no, it's the same. We cannot say that no, everything is there. Iron chelation is there. So iron chelation, this was very hard for us. Blood transfusion, we got used to it. It's only 3 to 4 weeks one time. And also it wasn't like now in a daycare center. We were admitted to hospital.
Oh, okay.
I have to be admitted today, discharged tomorrow for a simple blood transfusion.
Wow.
That's how was the protocol at that days. I'm not saying in UAE this was the situation. No, in UK, in Germany, in everywhere, this was the situation. Blood drops has to be very slow. Now blood is packed and clean, so you can have it faster. Lot of development came into our treatment. This is all fortunate things happened in thalassemia community within UAE.
Right.
It's too personal, but maybe people like to hear it or will benefit someone. For me, it was always me and my brothers. We need to take blood on the same day.
Okay.
It was easier for my parents.
Right.
My father was in an official position in the government. He cannot go and come every day for hospitals. Likewise with my mother. My auntie always was staying with my mother.
That's lovely.
I can't forget these kind of things. We got good support. So I remember things happened during this when these twins, they were very young. in thalassemia centers, usually when we go, first we have to do the vital signs, then go to cannulation room.
Mm-hmm.
Cannulation room, this cannula is very painful. Till now.
Yes.
I cannot say now I am very brave, I can do it. No, it's painful. It is painful. So I know the pain. So I'm seeing now my brothers are getting this injection. One of them said, Saeed, when will be the last time? There was no answer.
Right.
How I can say last time when you die? There is no answer. So I still this is here. But I'm happy to see them now. MashaAllah, they are. Each one of them has his own family. But still, I feel they are my kids.
Yes, of course.
My
of
kids. I'm responsible of them, their kids till I am alive.
Of course. And it's exactly what you said. When you go through something and then you see a loved one, especially when it's like a younger sibling going through it, it hurts more.
Yes.
Even though you're going through the same thing, it still hurts more because you feel like they're looking up to you for comfort and for strength, and you don't know what to tell them. Like when he asked you when is the last time.
But I try always to be strong, not only in front of them. Thankfully, I have my patients respect to me, love to me.
Yeah.
They know me because I had this opportunity to work for Thalassemia Center in Dubai Health Authority early days.
Okay.
I was the receptionist for Thalassemia Center 1997 to almost 4 or 5 years. I was in the reception seeing all the patients.
Wow.
I know them all. They know me all, their mothers, sisters, brothers. They know me. So I remember even my assignment to be there in the front desk was the great vision of the leadership at that days in the hospital, that let them see Saeed.
Yes.
Let them see Saeed is working, coming to work like us, 7 to 3. I was present there and everyone knows me. So it's not matter only my 2 brothers.
Yes.
No, I lived with them all. I had good experience with people till now. I'm in touch with them. There are people went for bone marrow transplantation and now they are normal human beings. Still the communication is there. Regardless of my being in the Thalassemia Society or not.
Yes.
No, my relationship is still there with my physicians. I know Dr. Mariam since she was doing her school.
Yes.
Not now. There are people really supported us.
Yes.
Really supported us. It's not only support of father and mother and teacher. First support is the blood donor. Without blood donor, nothing will come later.
Yes.
So blood donor is the first. Like my father always was saying, sometimes in family occasions, marriage or this gentleman was donating for you. This gentleman was donating because that days you need to bring your relative to donate for you.
Yes.
Wasn't that blood bank and it was safer to know the donor.
Yes.
Blood screening and these things was not that advanced as today. Today I don't need to know the person because the blood is checked. I'm safe. I'll do my blood transfusion. But so I know my donors. They feel nice when I go and say hello to them. They feel happy to see me in this age.
Absolutely.
Yeah, because definitely they were hearing the same early days that Saeed, 15 years, 16, 14 years he will die. This was always there.
Yeah.
Unfortunately, till nowadays, sometimes we are facing this kind of answers.
Yeah.
I had one experience. I went to one of the hospitals, without mentioning any name. Private, very big private hospital within Dubai. I had a trauma. I played football. I had a trauma.
Okay.
So when you go to any emergency department, they will ask, what is your medical history? So I have to say, yes, thalassemia, I'm taking blood transfusion, iron chelation. He said, no, you are not thalassemia major. I said, yes, I am. He said, no, you are thalassemia minor. So why? He said, how old are you? So, but he thinks, if you are thalassemia major, you should have been died long time ago.
Oh, wow. Okay.
So for me, it's funny.
Yeah.
It's funny. Because he learned about thalassemia when he was in school maybe 20 years ago. He doesn't need to be updated. He's not a hematologist. This kind of things happens.
Yeah, of
Happens.
course.
In marriage.
Yeah.
In marriage especially. In marriage, yes, this is happening a lot. And it's hurting us.
Yeah.
It's hurting us, but we don't show.
Yeah.
This is for male. I only have memory with male. With females, I don't know. We have lot of females with thalassemia.
Yeah.
We have also lot of them married with kids.
Yes.
Yeah.
Absolutely.
But we have also not married. But the younger sisters are married.
Yeah.
So this kind of things is there. And also there was challenges with us. My marriage went smoothly, very good, because my partner understand what's my issue.
Yeah.
It doesn't matter if you search about thalassemia, it doesn't matter if I am thalassemia major or not. I'm in good condition or not. The main part is my partner is thalassemia minor or normal. So the problem is with the partner doesn't know himself.
Yes.
But how you can... there are some marriage proposal was rejected. But still there are some people are supportive.
Of course. And it happens with a lot of chronic diseases as well.
Of course,
I mean,
of course.
any chronic disease is still taboo in our societies. They still look at it as
We
a big
understand.
question mark. Yeah.
We understand this. I totally understand. Yes, I might be rejected for for any reason. One of my brothers yesterday, he got better opportunity, work opportunity. He went to do test like any employee.
Yeah.
So in the test they said you are not fit for work. He's working since 13, 14 years now. So today he's not fit. So we have to go and speak to them. No, he's a normal
And
human
explain,
being. If
yes.
he takes his blood transfusion, so this kind of small things is there. This doesn't make any sense with my brother. He knows that the other person doesn't know about him.
Yes.
But it's not good for his wife.
Yeah.
Not is good for my mother. The pain comes to them.
Yeah.
For me, it's okay. He doesn't know.
Yeah.
Inshallah, one day he will know.
So you spoke about the challenges that you faced as a child, not being able to engage in physical activities as much as other children, and, people saying, no, Saeed has to sit, he can't play, But can you tell us about some of the challenges you faced as an adult with thalassemia?
Now I'm talking about myself.
Yes.
I have seen this in others, but definitely not all.
I only mention this because you mentioned blood transfusion, and a lot of people think it's like the hardest part of thalassemia.
Yes.
So I just wanted to know, is it, and what were some of the
No,
challenges?
I do remember it was like my marriage 2003, 2001, 2002. The government sent me abroad.
Okay.
Before that, yearly my father was sending me abroad.
Okay.
But in 2001, 2002 was director of Al-Wasl Hospital, the place I have been treated all my life. He said your results became very bad.
Okay.
You need to go abroad. At that time I was 18, 20, 22. You are in an age that you don't think about anything. You need your fun. That's it. So I was living in this, and also circumstances at that time was little bit. My friends in Thalassemia Center, I lost, unfortunately, good number of friends. So my thinking was, and others, that I take my medicine or not, I'm going. So let me enjoy my life. My friends are going to vacation, I'll go with them. I don't care about my iron chelation. So what? I will ignore it for 1 week, 2 weeks. So these kind of things came into even my life. That time I was still healthy, walking, normal, but my results shows very, very bad in terms of iron level, which is the hardest part in any thalassemia patient. So the government sent me to UK.
Okay.
I went to the hospital. My turn came, Professor Hofbrand. Now he's retired. God give him, inshallah, long life. When I went in, he knows me since very young ages, and now he saw me in this age. So he said, when I saw your results, I thought you will be coming by stretcher or if in a better health, on wheelchair.
Okay.
But you are saying you are playing football, you are doing this, you are doing this, doing this. Sit here. Then why you are not taking your medicine? I said I don't like to take it. It's painful, making my skin look bad. I want to go to swimming pool. I lot of things. At the end, I said, and my friends, so and so, they passed away.
Mm.
So I might go on at any time. He said, always think about it's no matter how long you live, no matter how long you will be healthy.
Mm.
You can live with ventilator 90 years,
Yeah.
and you can live healthy 40 years.
Yeah.
Run for that. At that time, I listened to him because he was developing new medication for iron chelation. In a state of 12 hours injection, it was oral.
Okay.
But it was not yet approved by FDA, and government won't buy any medication not approved.
Of course.
So I had to buy it.
Mm-hmm.
And my father bought this medication for me. He was buying it till, I think, 1 year. It was very expensive. Very expensive medication. For 1 year, my father bought it for me. Then it got FDA approval. And I started communicating with other patients that I'm taking tablets, you guys are still using needles. So everyone make sound and ask for this medication. Now the government is supporting everyone.
Amazing.
For the good thing here for the government, price is not important.
Mm-hmm.
In terms of healthcare, price is not important. Now, I didn't know what is the price of the drugs I'm receiving till my father bought it for me.
Mm.
Till now, I don't know this kind of investigation or screenings they are doing. It's how much. No one asking us to pay single dirhams.
Mm.
Even when we go abroad, I don't know what is my bill. Now I became later in a bigger position in thalassemia, so I know what is the cost.
Yeah.
So now I know what was my father doing 45 years ago to make us now in good health. What is my government have done for me later to still make me survive with this bad disease in a good condition.
Yeah.
Having family, working, doing like any other.
Yeah.
I cannot see myself less than anyone else. I do whatever even the physicians was saying don't do, I was doing it. As I like to take it.
Yeah.
I'll take it as a challenge. What will happen? Anything happen, I'll go to hospital. So this is, I'm not advising people to do against medical advice, but it's nice always to have the challenge.
And it goes back to the mindset that Dr. Hoffman, right? Hofbrandt was telling you about. It's about living a quality life rather than just living for the sake of living.
Exactly. And it's I mentioned Hofbrand because we talk about these kind of things, but luckily here in UAE, really we had a good people behind us.
Yes.
Really we had a good people behind us. There are nurses which are resigned and they went back home. They are still in touch with us.
Yeah.
There are physicians, they are retired at home, they are still in touch with us. We had support of them not only in Thalassemia Center, in our houses,
Yeah.
in the school. I mentioned in the school the difficulties for me. There are some physicians they were coming to the school to tell them that he can do sport. It's not his job. This is not his KPI. This is not his job description.
Yeah.
But this is his, because he's a human being. He
Yeah.
lives with us. He knows us. In our marriage, they are there involved. In our death, they are also there. I have to say, number one support is definitely blood donor. We had really good support from everyone.
Yeah.
Government number one, but individuals.
Yeah.
Individuals, they supported us.
And you have been an advocate as well for thalassemia. And
I have
you
to.
worked, yeah.
I have to. It's matter of social responsibility, number one. And I don't want people to say or to think I'm doing this because I have two brothers. No.
Mm-mm.
I have 1,500 patients.
Yeah.
They all deserve the best.
Yeah.
Local, non-local, it was never mentioned in any thalassemia policy in UAE. It was not a point of discuss even.
Yeah.
That this is local, has to take this medicine, expat has to take this medicine. No.
Absolutely.
We were treating even people with no residency visas. Support was 100%,
So you worked in the center for 4 years, you were saying.
more than that.
More than 4
I
years.
worked for Dubai Health from 1997 till 2011.
Okay.
Yeah.
And so how do you support then or advocate for thalassemia at the moment?
From Thalassemia Center, I became a board member in Thalassemia Society as well.
Okay.
Yeah.
Okay.
I went for the election. I was member, but not a board member.
Okay.
So the members, they are allowed every 4 years to elect
Okay.
whoever wants to nominate himself as a board member. I think it was 7 people or 9 people has to be nominated. So I went to nominate one of my friends.
Okay.
He was nominating himself. I went to give him my vote. Then I saw everyone knows me very well. Everyone respects me and this and this. Miss Khalda Khammas. She's now the General Secretary of Emirates Thalassemia Society. One of the big support to us.
Okay.
She said, Saeed, why don't you nominate yourself? Everyone wants you. And we need a patient on the table of decision making. So I nominated myself. And I got the maximum votes. I became a board member in Thalassemia, so I can't forget these people like Khalda Khammas, Dr. Asam always was support to us. Those people, very important people in our life.
Yeah, absolutely.
Exactly like father, mother, elder brother. Always they were behind us.
Yeah.
So I became in Thalassemia Society. Thalassemia Society, we are in partnership also working with the International Federation. So from there, I became to attend conferences outside Singapore, I don't know, wherever, any conference about thalassemia, I were always invited.
Okay.
Because they were proud that there is a patient in UAE, he's a board member and this. So it was also good for me. It was a nice opportunity.
Yeah.
Then in the nominations for election for Thalassemia International Federation, this was 2014. I wasn't in Thalassemia Center anymore. I became to work with His Highness Sheikh Sultan bin Khalifa bin Zayed.
Okay.
Sheikha bin Saif, wife of Sheikh Sultan, she was the chairperson of Emirates Thalassemia Society.
Okay.
So under her support, we had a better opportunities to attend those conferences.
Okay.
Those attending these conferences is very expensive, but Sheikha was behind us always. When the other countries, very neighbor countries, rich like UAE, they were struggling. How many we will send? 4 patients, 6 patients? No, budget will not allow. We will send 4. We were traveling with private jets.
Wow.
Yeah, to attend the conference. Not me and other patients.
Yeah, of course.
If we decide 6, she will send 20.
Wow.
Yeah.
Wow.
So in Turkey, we became board members. Her Highness and myself.
Okay.
2 are allowed from each country to be in the board of Thalassemia International Federation.
Okay.
So we got the maximum, the 2 seats in the board from 2014. Till now, the main support is Her Highness.
Yeah.
If I'm talking as an individual, I'm not talking about treatment. Treatment is a healthcare sector. They are doing brilliant job. But as an association, NGO, Emirates Thalassemia Society, or TIF, Thalassemia International Federation, since they're in Turkey, we became board member of Thalassemia International Federation. Thalassemia International Federation is based in Cyprus,
Okay.
not in Turkey. But the conference was in Antalya, in Turkey.
Okay.
So they did the election in the same place. It will be easier for people do not travel 2 places.
Yeah.
So it was all there. Since then, I really felt a special support from Her Highness to the community of Thalassemia. It was unbelievable. I was working very, very close to Her Highness family. I was seeing kind of support. I never asked for any amount, for any help, for any patient. unless the same or more comes to me to give. This support was inside UAE, outside UAE, and also in international level if there is activities. Type of societies, NGOs, is a little bit different between here and other countries.
Right.
For example, UK Thalassemia Society, they don't work to support thalassemia patient for education. No. They are involved in regulations, in policies, in hospital, how they manage the patients.
Right.
Here the hospital doing their job. Because they don't count on charities to give Said blood transfusion or iron chelation.
Right.
Here the society is doing marriage support. Society is doing school support. Society is doing activities like a child. Her wish was to go to Disneyland. So not only the child will go, 12, 13 patients will go, 2, 3 nurses will go, 2, 3 physicians and escorts. They all will go to Orlando to have fun for 1 week and come back. So here is little bit different. I'm not saying I'm right, they are wrong. No, it's the same. Support is support.
Yes.
Whichever type is support. Her Highness always was support to us, and the luckiest moment that she became involved in thalassemia, not as a chairperson, as of her personality.
Yes.
As of her personality. Before, I remember, before 2014, all over thalassemia patients from UAE, they were coming to Dubai for blood transfusion. Now we have Thalassemia Center in Fujairah with full sponsorship of Her Highness. We have a Thalassemia Center in Ras Al Khaimah as well. In Abu Dhabi, 2 days ago, I heard that there is a private sector doing a Thalassemia Center. So this is very good.
Yes.
This is very good to have a lot of centers. It's they are not challenging each other. They are not competitors. They are giving service.
They're supporting each other as well.
They are supporting it, definitely.
Definitely.
Because, till when Dubai Thalassemia Center will be full. For example, my blood transfusion has to be day before yesterday. It's full. Now my appointment is tomorrow.
Okay.
But still, I don't let my hemoglobin goes very low. This is the latest age challenges.
Yes. And these are part of the UAE's developments. I mean, the UAE has always,
Yes.
tried its best to keep up with the times, but on the contrary as well, to be ahead of its time. And the fact that you were saying more centers are opening is, again, support for each other. As you said, centers are filling up. So there has to be a distribution.
Exactly.
All people from all Emirates were coming to Dubai. Now people have options closer to them. And I think it will grow and grow even more.
No, it's not only this. It's also about, I think, healthcare policy.
Yeah.
Now, anyone in the country needs to be insured, medically insured.
Yes.
So it doesn't matter to expand the services here and there. It's if the cost is a point to consider, which I don't think.
Yeah.
With private sector is something else. With the government, no number counted if it comes to patient.
Yeah.
This I not only believe, I am feeling this.
Yeah.
I'm feeling this.
Yeah.
Also now, after leaving my new role in the community or workplace is in healthcare as well, but not thalassemia, in other institute which is for long-term and rehabilitation centers and this kind of things in Abu Dhabi. And also I can see how government is supporting those patients.
Yeah.
Those patients, there are a lot of them can stay at home with home care nurses. But still there are hospitals and there is insurance coverage or government coverage. They are still having better quality of life.
Yes, absolutely.
Yeah.
Okay, on a last note, I know you're a very busy, busy person, but I just wanted to ask you one last question because you mentioned that the most important role is the donor. And the person that is donating this blood. And I remember, because I went to university here, and we always had blood donation drives. And I remember how exciting it was for us to be able to be part of something special, to be able to donate our blood, even if we don't know where it's going. But it's going to benefit someone. What's your advice, or what's the one thing you want to tell the world on International
Now-
Thalassemia Day.
If we just go little bit back of one of the initiatives came up under His Highness Sheikh Sultan bin Khalifa. It was Thalassemia International Award.
Okay.
Yeah. Thalassemia International Award, it talks about, there are categories. It's national and international, two
Okay.
categories. Each one of them, we were awarding people. This award is a financial awarding to people, monetary awarding to people.
Right.
It is the best parent.
Oh.
One category says best parent.
Okay.
One category says best thalassemia center.
Okay.
One category says best media coverage.
Okay.
One category says best nurse, best physician, at the last best patient. So every 2 to 3 years, these people were selected very carefully and awarded. And it was big number of amount they were receiving. So if you, this is the answer of your question. Those are the main people supporting thalassemia patient to be in a good health.
Yeah.
Parent, center, nurse, physician, media coverage, awareness project. So this was very also good in thalassemia world that UAE is doing this initiative.
Yes.
So we were having nominations from everywhere. And Professor Hofbrand was awarded because of his iron chelation development.
Oh yeah, the
He
medicine.
was awarded in Abu Dhabi.
Amazing.
Yeah. So it's a really beautiful initiative, and more to come. Under
Yes.
leadership of Her Highness, more to come. I'm 100% sure.